Hello, I am AshleyBourg, and I will discuss the healthcare delivery system in the United States. Having a basic understanding of the healthcare delivery system in the U.S. is vital as it allows individuals like ourselves to make better decisions about the healthcare that is offered. A basic understanding of the positives and negatives allows us to make decisions to improve the healthcare delivery system for both ourselves and hopefully for others. Seeing 2019, the healthcare system in the United States is a fragmented healthcare delivery system that combines both private and public healthcare networks. The fragmentation is partly the result of both insured and uninsured individuals within the United States. Pertaining to the uninsured individuals relying on Medicare and Medicaid for healthcare coverage, the Affordable Care Act, or the ACA, sought to close the gap between the insured and uninsured citizens in the United States. According to Seeing 2019, the Affordable Care Act was created during the Obama administration in March of 2010. The ACA aimed to expand access to health insurance, reduce healthcare costs, and improve the quality of care. In 2014, the expansion of healthcare coverage through the ACA improved access to healthcare and prevented millions of citizens from postponing their healthcare needs. The ACA expansion also helped increase the use of nursing homes and community-based long-term care services. The ACA's expansion of outpatient services significantly reduced the need for inpatient services. The ACA also increased health insurance coverage for low-income individuals, particularly those in minority populations. Another benefit of the ACA is that the hospital readmission reduction program introduced by the ACA seeks to penalize hospitals that readmit patients unnecessarily. Ultimately, this program hopes to hold hospitals accountable for their actions. So, who are the providers? Some essential providers are healthcare providers themselves, such as doctors, nurse practitioners, specialists, and physician assistants, to name a few. Providers in the United States healthcare system, and any healthcare system really, manage the health of individuals seeking care for their health needs. To sum it up, any individual within the healthcare system that provides care to individuals is considered a provider. Health inequities regarding providers in the United States are often perpetuated by healthcare providers who may exhibit bias or lack of cultural competence. This leads to disparities in care for marginalized communities such as low income or people of color. These inequities are further exacerbated by systemic barriers such as limited access to quality of care, as well as low income and rural areas. Health inequities in coverage in rural and more impoverished areas are due to the lack of providers as well as the lack of medical facilities. A study conducted by Schneeberger in 2023 identified barriers to patients' choices between inpatient and outpatient care, such as the availability of medical facilities and the type of care offered in each setting. These barriers are especially pronounced in healthcare workforce shortages or inadequate infrastructure for outpatient services and disproportionately affect populations in low-income or rural areas. What is the fee-for-service system? The fee-for-service system is where providers are paid a fee associated with each service provided to a patient, regardless of the outcome. Due to the fee-for-service system in the United States healthcare system, hospitals tend to charge for each individual service performed and for the item used during the care of a patient. Unfortunately, hospitals are incentivized to conduct more exams and tests even if they are not medically necessary. This system has affected healthcare costs as it is one of the most key determining factors of the high cost of health-related services, explicitly relating to physician fees charged to the patient. Healthcare services are any service that requires admission into a hospital or inpatient facility. This would include medical conditions requiring surgery, such as open heart surgery, or other examples might include admission to a mental health unit due to suicidal ideations. In general, hospitals are among the most used inpatient healthcare systems for all individuals in the United States. Services are considered any healthcare access not conducted while actively admitted within a hospital. The Affordable Care Act has enabled many Americans to access healthcare services through primary care clinics. Regular visits to a primary care provider enable individuals to stay on top of their health as preventative services such as annual screenings and vaccinations are mandated. Outpatient services are geared more toward less complex health needs that may require specialized healthcare services. For this reason, outpatient settings may not provide the necessary resources or facilities. What are some of the health inequities related to both inpatient and outpatient services? Health inequities to outpatient services and inpatient services are driven by limited access to care in underserved areas, such as low income or rural populations with fewer options in healthcare. Financial barriers such as high out-of-pocket costs and inadequate insurance coverage prevent many individuals from seeking necessary treatment. Additionally, cultural and linguistic barriers, along with systemic biases in care delivery, can result in lower quality services for marginalized communities. How do inpatient services address health inequities? In inpatient settings, hospitals in undeserved areas may expand services or partner with community organizations to help care for low-income or rural populations. Financial assistance programs, such as sliding scale payment systems, help reduce the burden of high costs for uninsured or underinsured patients. Additionally, many hospitals implement cultural competency training for staff to ensure that patients from diverse backgrounds receive respectful and effective care. Community outreach and partnerships further improve care by addressing social determinants of health and providing education and support to marginalized groups. How do outpatient services address health inequities? In outpatient settings, services like telemedicine help overcome barriers such as transportation and geographic isolation, especially in those living in rural communities. Insurance navigation support is also provided to help low-income patients enroll in insurance plans. Additionally, cultural and language services help provide language to those that speak other languages other than English. Furthermore, hiring diverse staff in offices can help with this barrier. Furthermore, outpatient services emphasize preventative care and health education, empowering patients to manage chronic conditions and maintain better overall health. These efforts aim to reduce health disparities and improve access to quality care. Purchasers would include employers or individuals purchasing private health insurance plans. Individuals with private health insurance typically pay out-of-pocket payments such as co-pays, deductibles, or full payments that can depend on the cost and type of the treatment. Out-of-pocket costs have increased due to the fee-for-service system. The fee-for-service system in the healthcare system in the United States has affected healthcare costs as it is one of the key determinants of the high cost of health-related services, explicitly relating to physician fees charged to the patient. Purchasers would include Medicare and Medicaid. The federal government funds Medicare to provide healthcare coverage to disabled individuals and those over the age of 65. According to Sheehan Singh, they discuss a coverage gap specific to Medicare Part D that leaves individuals paying more out of pocket for medications. According to the Centers for Medicare and Medicaid Services, individuals are responsible for a more significant portion of the medication cost once they have spent a certain amount on prescription medications, but before the individual has reached the catastrophic coverage phase. The federal and state governments fund Medicaid to provide healthcare coverage to low-income individuals. Providers can choose whether they participate in allowing Medicaid patients to be seen by their practice. This limits accessibility to those with Medicaid and contributes to longer wait times in clinics participating in the Medicaid program. In all, great strides have been made to increase healthcare access to all individuals and not just those with health insurance. through providers having a better understanding that increasing access can directly influence who receives care. These providers can better help these individuals increase access to health care through a primary care physician. Furthermore, increased expansions to both Medicare and Medicaid can hopefully reduce healthcare cost burdens on individuals and aid in their overall health as they are better able to access healthcare services.